As I discussed previously, diabetes is a multi-organ disease and it targets the kidney. Can we do some tests by which we can know, is the kidney involved? Yes, this test is called as microalbumin. What is microalbumin? Albumin is a protein that is present in blood. Normally, albumin is not secreted by the kidneys. Kidneys are able to conserve this protein. However, very small quantities of albumin leak into the urine. And since albumin is a 60 kilodalton protein, it is at a threshold level that even a small amount of damage to the kidney, albumin will be the first protein to leak out. Although albumin appears in small quantities in the urine, it is called as microalbumin. So microalbumin is the measurement of small amounts of albumin which is appearing in the urine. It is not albumin which is small, however, it is the quantity of albumin that is less. Microalbumin is a predictor of cardiovascular disease in patients who are diabetics. Not only does it indicate that the kidney is secreting more albumin, but basically what it indicates that the patient is likely to have a defects in vasculature due to which it is likely that a patient will have increased incidence of cardiac events. How do we estimate microalbumin? We collect early morning sample. Why early? Because it is possible that because of excessive activity or exercise, the urine in normal patients can show some amount of albumin. So when we do test for microalbumin, it is important that the patient gives an early morning sample, not necessarily the first morning sample, before he resumes any physical activity. It is possible that the patient has had a lot of fluid due to which the urine can be dilute, or it is possible that the patient has had less water due to which the urine can be concentrated. So when we measure microalbumin, it is important that we express it as a microalbumin to creatinine ratio to rule out the effect of dilution or concentration of urine. The reference ranges for microalbumin are it should be less than 30 microgram per milligram of creatinine in normal patients. If it is between 30 to 300, it is called as microalbuminuria, and more than 300, it is called as macroalbuminuria. Most diabetic patients will have microalbuminuria for several years before they present with cardiac symptoms. So it is important as a diabetic that you measure microalbumin at least once in 6 months to know whether you are keeping a good control of your blood sugar and whether you are likely to produce any cardiac disease in future. Since diabetes also affects so many organs, it is important to know whether you are keeping your lipid profile in check. Lipid profile typically has to be done with 12 to 14 hours of fasting. It should be avoided during illness because during acute illness like fever or dengue infection, the lipids may be suppressed. What do we do when we do lipid testing? We do cholesterol, triglyceride, and lipoproteins. LPA is a new lipoprotein which is done and is an independent risk factor for coronary artery disease. Since diabetic patients are at an increased risk of coronary artery disease or heart disease, let us look at the risk factors that cause increase in the risk of cardiac disease. The most important is family history, male sex, postmenopausal females, diabetes, hypertension, high LDL cholesterol and low HDL cholesterol. So diabetes is a very important factor that adds to the risk of coronary artery disease or heart disease. What are the other investigations that we can do in diabetes? Diabetic patients, like other normal individuals, can suffer from other deficiencies and diseases. Thyroid dysfunction is a very common disease in the general population. Presence of hypothyroidism is extremely common, and hypothyroidism can increase cholesterol levels. It can also affect glucose metabolism. So coexistence of diabetes and thyroid abnormalities is not uncommon, and this has to be looked into even in diabetic patients. Vitamin B12 and vitamin D3 deficiencies are also extremely common. Replenishment of these vitamins will help us in helping us in diabetic patients to control their symptoms. Creatinine. Creatinine is a measure of the function of the kidney. Levels in diabetic patients who have been diabetic for several years, the kidney slowly undergoes damage, and due to this creatinine rises. However, it should be remembered that the relation between serum creatinine and the kidney function is not linear. In this picture, you can see the serum creatinine on this axis and the glomerular filtration rate, which is a measure of the filtration capability of the kidney, on the x-axis. What is important to note that in a normal individual, the kidney glomerular filtration rate, or the rate at which the kidney filters the blood, is around 120 ml per minute. It is only when it drops to less than 60 milliml per minute that the creatinine slowly starts rising. So creatinine is not a very useful, it is not a very sensitive marker of renal disease. It's only when more than 50% of the kidney is damaged that the creatinine levels in the blood start increasing. When the level is around 2 milligram percent, the GFR may be as low as 30 ml per minute. So increased creatinine levels is not a good sign. It tells us that the renal function may be compromised and we have to take steps so that the creatinine does not go up any high, and we have to take steps to see that creatinine is back to normal. So in diabetic patient, it is extremely important that we do serum creatinine to know what is the state of the kidneys. My friends, diabetes is here to stay. Let us help to keep it in check. Thank you so much.